It is Wellness Wednesday, and today's topic is multiple sclerosis, a disease that impacts the central nervous system, essentially causing the body to attack itself. In this sponsored segment this morning, we're joined by Dr. Robert Pace, neurologist at Memorial Healthcare Institute for Neuroscience, here to talk more about multiple sclerosis. Good morning.
Good morning.
Yeah, thank you for coming in.
Thanks for having me.
I gave a basic synopsis there, but tell us a little bit more about exactly what MS is.
Multiple sclerosis is a chronic condition in which your immune system learns to attack something in your body. Your immune system is made up of very powerful cells that can cause a lot of damage, but usually they're damaging viruses or bacteria or something else that's a threat to you. But in autoimmune conditions, your immune system learns to attack something else in your own body, and in multiple sclerosis, those are cells in your brain and spine called myelin. So it causes damage episodically to the brain and spine, and that leads to a variety of different outcomes.
Well, I mean, honestly, that is a little concerning sounding. They're talking about the field that you work in. How many people does this impact?
Well, there's over 1 million people in the state of Michigan with multiple sclerosis. It's the most common neurologic condition that affects young people. And in the United States right now, it's about 1 in 400 people are affected by MS.
Wow. Well, you know, with that said, what are some of those signs, symptoms that people should look out for?
That's a difficult question because multiple sclerosis is probably one of the most variable conditions in all of medicine. Because it's affecting your brain or spine, and your brain and spine control everything, any symptom that you can imagine can really be part of MS. But what we see often is people with weakness in one area of their body or numbness in one area of their body, sometimes changes in their vision. A lot of times the changes happen fairly abruptly over the course of a couple of days or so, and we really can see anything, and therefore we have to sort of keep our eyes open. Well,
give us some insight here. You know, as the expert, what are some of those things that you look for, and how do you reach a diagnosis?
Well, the mainstay of diagnosis is our MRI. When people come in with symptoms that could be related to multiple sclerosis, we're usually going to get people set up to get an MRI, which is an outstanding and clear picture of the cells in your brain. So once we have that information and we can come up with a diagnosis, then we can start the process of helping people and treating them.
Yeah, let's dive into that a little bit more. What are some of those treatment options that are available for people with multiple sclerosis?
We're lucky because we have a lot of treatments now. There were no treatments at all for multiple sclerosis until the early 1990s. And from a medical standpoint, that amount of change in that short of a time is pretty rapid. Now we have over 20 treatments that are all geared at calming down the immune system to protect people from the immune system overreacting and causing damage.
So bottom line, I mean, should people out there be encouraged, I guess, when it comes to advancements in treatment?
Absolutely. We are doing things worlds better than we were even 10 years ago. And we have a lot of great options now that mean that this is not as devastating a disease for as many people as it was in the past.
Yeah, and then finally, what is your message then to folks who may be facing a diagnosis? How does their prognosis look for the future?
The prognosis is excellent, and we can do a lot of things to protect people. So the first thing that I would tell anybody that's newly diagnosed is don't panic and don't read too much into the internet and Google and things like that. Come to one of us and chat about it, and usually we can come up with a plan that makes people comfortable and protects them.
Well, listen, we really appreciate your insight this morning. For more information, you go to memorialhealthcare.org. You see there, you're in good hands, and there's a number there on your screen that you can call. Thanks for coming in.
Thanks for having me.
Yeah, good to see you.